Assalamu alaikum wa rahmatullah. For today we'll start with bridging and barriers, bridges and barriers in therapeutic relationship. In therapeutic relationship and in every relationship, we might have some problems. We might have some obstacles that interfere with our communication. We might have some boundaries. So how we can overcome them? How we can bridge them? In your communication with your client, did you face sometimes problems with dealing with those patients and you overcome that problem from your experience? Did you have a problem with your client in communication? Sometimes, yes. Like what? Misunderstanding. Might be misunderstanding, yes. Sorry, I couldn't hear you. He didn't want to speak with you. To speak with you as a student or as a nurse or as a health worker, because sometimes they might have any issues regarding the student. Or why do you think that he didn't want to speak with you or to give you an information about himself? Because of his health condition, you mean? Yeah. So it might be because of his health condition, because of pain that he is having, or because of the complaint that he is having. So, but even though, when the patient is having complaint, or when the client is having complaint, he wants someone to tell them about. But why do you think that he is not communicating with you as a student? No. He said that it might be because of his condition. He might be in pain, he might be in... because of that, he didn't want to communicate or to with you as a student from a health worker. But even though in this condition, when the patient is having complaint, he wants someone from the health worker to communicate with him and to tell him about his condition and the change in his condition in order to get a help, isn't it? So why he might not give you the information?
Because the student doesn't help anything.
Because sometimes he feels that you are a student and you are not having the authority to give something or to give a change sometimes. It might be like this. So we will come to, from a different aspect, we will see what kind of barriers and how we can overcome them in this. So in this session, the objective that we will cover, we have 4 objectives. The first one, we have to identify the concept that enhance the development of therapeutic relationship. We have to explain the barriers to the therapeutic relationship, and we have to describe the nursing action designed to promote trust, empowerment, empathy, mutuality, and confidentiality. The 4th thing, identify the nursing action that can be used to reduce anxiety and also respect personal space and confidentiality of our client. So those are the objectives that we will cover during this session. If we go to the communication skill, in communication skill, it is influence the outcome. Your way of communication it will influence the outcome of your care, the outcome that we want to reach. So, such as either it might lead to anxiety of the client due to your way of communication. If we are not communicating in a proper way with a client, it might lead to adherence to the treatment regime. If we are communicating properly with the client, so he will be following the treatment regime and he will be following your advice. And also, it is, in the other hand, if you are not doing well, in this case, adherence to treatment and accepting treatment, it might not be there. Also, satisfaction of our client with the care. So, in self-satisfaction of our client, also it needs a good communication and good communicator in order to feel that or the patient to have the feeling of satisfaction and he is getting the proper care. To establish therapeutic relationship, you need to understand and apply the concept of respect, caring, empowerment, trust, empathy, mutuality, confidentiality, and veracity. We will come to each of them. So, in order to communicate, to establish a good therapeutic relationship with your client, so you have to take all of those in consideration. So, in a client relationship, we have many barriers that might be there, but we have to overcome all those barriers in order to communicate well, in order to get a proper, to give a proper care and to be accepted by our client. So, in bridging the barriers, we have to give a care, proper care for the client. When the client feels that we are giving him the proper care, this will remove the barriers between us and between our client. When the client feel and when we feel as a health professionals that we are respecting each other, also this will remove the barriers and prevent those barriers from being continuous. Trust also. When trust and veracity is there in between us, this will remove the barriers. Mutuality, confidentiality, our behavior when we are having ethical behavior, all of this will remove the barriers in between us and between our clients. The barriers or bad use or improper use of all of those bridges, it might lead to anxiety. Anxiety, it will keep the barriers there. Stereotyping also. When always we are saying the same thing to our client, this also increases the barriers. Space violation. This also will cause a problem with us and keep a barrier. If we also provoke confidentiality and violation of confidentiality, also this will affect the barriers. So, if we come to the respect, in respect, we have to respect our client value, and also we have to respect his opinion. We have to listen to his opinion. We have to respect it regardless to the way, regardless to the opinion that he is having, because we are coming from different society, we are having different kind of education sometimes. So you have to listen to them. Then respect his opinion, but in this case, you have to explain to him the better way of doing things or dealing with his case if he is having something rather than that. Also, when dealing with a client, one of the signs of respect is to call the client with the name that he is preferring. So when I am calling you with a name that you prefer, you will feel more relaxed. And the relationship, it will be more smooth in this case. So because of that, always you have to ask the client, what did you prefer to call you? The barriers that might be there and interfere with the respect, which is avoid talking with the client. Yes, we might be busy. As a nurse, you might have many work and many tasks that you have to finish within the time or the 8 hours of your shift. But even though for each client we have to try to find a time to talk with the client, to listen to him. By that also it is a kind of respect. But if he is trying to say something and sometimes we might make ourselves as we didn't hear what he is talking about. Or even if we are listening to him, but we are not doing something after that. We give them the time, but after that, no response. So in this case, it is useless. So we should not avoid talking with the client. Or being unfair with that client. Respect, lack of respect, it is a big barrier between the client and health professionals. In all communication, if it is social communication or therapeutic communication, respect it should be there. Respect, it will break down any barriers in between people. But if respect is not there, it will affect and it will be as a barrier. How we can show respect also? Is the respect only to respect our client? Or or it has to come also from respecting ourselves? So firstly, in order to be respected and to deal with a client with a sign of respect, we have to respect ourselves by being responsible about every word that we are saying, by following the ethical issues in our professions. We have to respect also our colleagues. If the clients see that we are not respecting each other, we are talking about other in behind, even in front of the client sometimes, or with others, or we are talking as a nurses or between the nurse or as a doctors between each other about other colleague. Did you feel that the patient or the client will see that positively? And he will trust you in this case? Because as you are talking about your colleague in a negative way somehow, in this case, he will feel that you will be talking about him also. So it will not break the respect, it will break the trust, it will break, or he will think of the confidentiality also, isn't it? So always, when in our relationship, we have to respect ourselves, to respect those, our colleague that we are working with them, respect our client. This will remove the barriers and bridge the barriers that we might have in the communication with others. So in order to overcome all of those problems or all of those obstacles between us and others, we have to overcome it by the sense of respect. Respecting our institution, respecting our colleague, respecting our client, respecting ourselves. So by that, we will build a good relationship. We will build up the trust between us and our client. Also, the caring. We are there in order to give some care to our client according to the demand, according to the need of that client. So, provision of care that facilitates the health and healing process. If we are providing care, that care should be toward the objective to facilitate the health and healing process. Understand the client perceived need. We have to understand his need. And the client like to understand why they are suffering. So we have to explain for them. We have to be knowledgeable and able to explain to our client why he is suffering from so and so. Why his complaint is like this. So if it is fully explained and explained in a scientific way, in this case, trust also will be more. And he will feel that you are caring and trying to know his problem and to find a solution for it. From the barriers that we have to, that it might show that we are not caring of the client, we are not giving the proper care. If the nurse is rushed to do a multi-need, she is always in a rush. She is not completing the work properly in order to complete work with others. So whatever you are doing, when you start to do something, you have to complete it. Unable to focus in the client. If he feels that you are not focusing on him, you are not focusing in his health issues, also this will interfere with the communication and relationship. Apathic, trying to meet your own need rather than the client need. Trying to get the benefit from the care of that patient. Trying to look for other benefits that you might get from that client from outside or inside, or from the institution, and you are getting a benefit but not giving the care, the proper care. All of this, it will be as a barrier for our clients. From the other thing that we have to see and overcome is the empowerment. What we mean by empowerment? If you feel that you are unable to do anything, is it a good or a healthy sign or a bad sign? So it is a bad sign that when you feel that everything it should be done by others, and I am there, I cannot do anything even for myself. Does this affect the treatment regime positively or negatively in this case? Does that feeling will affect the treatment regime positively or negatively? So it will affect the treatment regime negatively. So always, when we are dealing with our client, we have to show him that his ability of doing things. We have to discover his positive thing. We have to discover the thing that he is able to do it by himself, and to let him doing it by himself. In this case, the client will feel that still he is worthy. He can do something for himself. Even if he is an old man and he's physically, he is sick, he will be able to do something. We have to find out the capability and enhance and empower those capabilities and help the client to do the thing by himself. This is the dependency and interdependent and independent way. In nursing and in health profession, we are trying to shift the client from total dependency to total independence. While we are doing the treatment regime, while we are giving the care, we are giving the care not in order to have the client used to this care and he is asking always for that care. Definitely, he will be discharged and he has to be able to take for himself according to his physical ability. So we have always to find out the way and how the client can help himself. So assessing the client to take change for his own life. Also, Oram's view of client as an agent of self-care. So he is the agent for self-care. We should not let him to be as institutionalization or the feeling that he is always in need for the help from others. We have to raise his ability in order to do the thing by himself. Encourage the client to assume responsibility of his own care as he can and as he trained. It doesn't mean that we are just there to tell our client that this is the thing that you have to do and you have to do it by yourself. No, because you are trained to do those activities. In this case, if it is need, we have to train him how to perform it. What is, even with some physical disabilities, we have to find a way that how he can modify his ability and the way of doing the thing by himself as he can. The barriers that we have, you know that when we are doing the thing by ourselves, sometimes it will take a shorter time. Rather than if we are teaching the others how to do the thing by themselves. Because teaching, it will take time for the teaching, it will take time for the supervision, it will take time for the training, it will take time also for evaluation of the ability of the other to do the thing in a proper way or not. So it will take time. Because of that, sometimes sorry, the nurse will have the feeling that, okay, let me do it for you. I will do it better than you. By that, you are putting the client down. You are putting his ability down. So if he is able to do, we will train him, we will observe him how he is doing the thing by himself. So we have to avoid saying that I can do it better for you, or I know what to do is best for you. Those will increase the barriers. And those will keep the client feeling down and unable to do things. So always we have to enhance the client ability and to find the strength of our client. So by that, this is the empowerment of our clients. Did you understand this point? Right. Sorry. Then the trust. In order to communicate with others, we cannot tell things about ourselves to others unless if we are trusting them. So we have to build a trust, and we said from the beginning, trust and respect, they are going together. The client, he has to feel that he is safe, in a safe hands of others, in order to give them the information and in order to relax while they are giving the care for that client. If you are not trusting that the nurse or that physician, how is your feeling from inside about the treatment regime that he is advising us to do? Did you have that feeling sometime? If you are not trusting a physician or the nurse, are you going to her for advice or not? So in order to feel freely and to feel safe, you have to find someone that you are trusting him. Trusting him scientifically, trusting him that he is not provoking confidentiality. It is not only in scientific way. You might be the best physician, you might be the best nurse there, but you might have some negative point, that everything that you know about the client, you might give it to others. In this case, he will not feel the confidentiality. He will not trust you in the confidentiality here. So he have to feel that he is in a safe hand in the aspect of care, proper care. He has to feel that you are the knowledgeable one and the one who is able to take care of his condition, and you are also ethically involved, or you are using all aspects of ethics in dealing with others. So he will trust you, and in this case, it will remove the anxiety. But if I am going for someone for the first time, I might be feeling anxious that he might not give the proper care. He might not reach to the proper diagnosis. So always, in order to remove those barriers, we have to have the trust in between us. And by the way, all of those things, it will affect the end result. It will affect the outcome of treatment and healing. When we are relaxed, when stress is not there, also our body reaction to the medication that we are taking it will be different. The internal chemistry will help in the healing process. But if we are under stress, the internal chemistry, it will act negatively on the treatment regime. Because of that, we might have two clients who are having the same problems and they are given the same treatment regime. Some of them, one of them is anxious, the other is feeling relaxed, and he is trusting the health team there. This one who is trusting the health team and feeling relaxed, he will be cured in a shorter time than the others. Why? Because the internal environment is helpful for the treatment regime. Those are some techniques designed to promote trust. In order to promote trust, we have to convey respect of others. We have to consider the client uniqueness also. We have to show warmth in caring with others, in caring of our client. Use the client proper name, as we said. Being active listener. Being active listener, it means that we are giving the appropriate time for the client, we are listening properly to the client, and we are responding properly to our client. Giving sufficient time to answer his question and inquiries. Maintaining confidentiality. It is a very important aspect in order to get the trust of our client. Show congruent between verbal and non-verbal behavior. This is for better understanding of the message. So if your verbal and non-verbal communication is congruent together, this will help in the understanding. Also, use a warm and friendly voice, not shouting. Because if you are using high-pitched sound, in this case, it might be as if you are attacking others. Use appropriate eye contact according to need when we are in contact with our client. Always have a smile face and sense of humor. Having some flexibility which will go with the treatment regime. Also provide for the allowed preference. And the preference should be allowed, not the thing. Because sometimes, even for the diet, sometimes the patient might ask you that I want something from home. Is it acceptable or not? If it is according to the treatment regime, or if he is taking normal diet, why to prevent him from taking something from outside? If he prefer that. Or to prepare something that, because everyone is having his own preference. Even though some people, they did not prefer to, even if it is clean, if it tastes as well, but they did not prefer to eat food from outside. So why not to do that? Be honest and open also. Always be honest when answering your question. Don't cover some information about your client. Give complete information and answer his question properly. Provide consistency. Not morning I will tell something and in the afternoon I will tell something different. And next day I will tell another thing which is more different than the previous time. In this case, how he will trust me, how he will rely on me when I am giving a different answer and those answers are away from each other. Also have a schedule for each thing. And a schedule for your objective and when you will cover those objectives. Follow the comments also. We have to set limitations sometimes. Limitation for the relationship, limitation for everything related to the communication. So, because the relationship is limited to the health and health assessment and health care of our client. Control distraction while we are communicating with the client. The distraction nowadays, most of the distraction, it is our phone. That while you are talking with your client, they might use their phone. In some institutions, they are not allowing them to enter their phone in. They have to keep their phone outside when they are entering the institution. Use an attending posture. The posture, while we are talking with the client, always be at the same level of your client when you are communicating with him. Because that also will keep him more relaxed when you can bring a chair and sit beside your client while you are talking with him, while you are communicating with him, rather than being standing and he is lying. Your arm position, not to have a closed position while you are doing or communicating with him. Being relaxed. So all of those things, it will enhance the trust between us and our client, or the trust between us and others when we are communicating with them. Always we have to communicate with others in a professional way, regardless if it is social or therapeutic communication. Empathy also. Empathy, it is the ability to be sensitive to and communicate understanding of the client's feeling. We have to understand the feeling of the client. We have to put ourselves sometime in a position of that client. If we are in that position, what we will feel, you have to understand that. Yes, you might be younger and you might feel that you will not be in the position. All of us, regardless to our age, regardless to our health, we might be expected to be in the same position any day, in the same position of our client, and we might have the same situation. So how do you feel that you want to be treated in this case? You have to treat your client, you have to deal with your client as if you are the client and others are dealing with you. By that, when you are putting yourself in a situation of your client, you will understand his situation more, and you can conceptualize and understand his way of communication and his need, and to deal with that. The barriers that we might face is lack of time. One of the barriers also is lack of privacy. You know, in hospitals, in most of the hospitals, not every single patient is having a single room for him. You know that most of the wards, they are having 6 patients. And the thing in between the 2 clients is a screen. So that screen, sometimes it does not prevent the others from hearing what you are talking with your client. Because of that, he might feel that he is not having privacy. The privacy also when you are doing care for your client. Even though, as a health professionals, when we are dealing the care, when we are doing dressing, when we are doing bathing, when we are giving an injection, we have to maintain the privacy of our client. We should not expose any area more than the area that we are working with. This will decrease the embarrassment of our client and decrease our embarrassment. Even if there is sex difference, even if you are a female nurse and working with a male nurse, when you are doing your care and just exposing the area that you are working on, in this case, it will decrease the embarrassment of your client and yourself, and decrease your anxiety and his anxiety. And both of you will work in a relaxed environment. If we feel also lack of support, it can be by explanation, can be by care, it can be by all aspects, by showing and being able to care for your client. So this is also empathy. Maturity also. Maturity basically means that the nurse and the client agree on the client healing health problems and the means of solving those problems. Because of that, you have to engage your client in planning. You have to engage your client in planning of his treatment regime. And you learn that in the nursing process that we have to discuss the treatment plan with our client, and he has to feel that he is engaged in the process of planning. By that, he will follow that plan. Veracity. Veracity is legal and ethical standard and mandate specific nursing behavior like confidentiality. In each institution, there are a code of ethics. For each profession, there is a code of ethics and code of legal aspects that we have to be under it and to follow it when we are dealing with others. So, if we are dealing with that, if we are accepting that, if we are following those code of ethics, this will help us and prevent this in the communication with others. The other thing, which is anxiety. You know that anxiety is a vague, persistent feeling of impending dooms over us. So, we have to relieve the anxiety. Overwhelming violation of personal space. We discussed that previously also. Cultural barriers sometimes. We are having different culture, we are coming from different culture, and we might have different habits, we might have different opinions, we might have even different religions. So we have to respect them regardless to all of those aspects. Gender. Sometimes might not be accepted for a male to be given a care by a female nurse or a female doctor. Or he might feel more relaxed if he is having the care from the same gender. On the other hand, others, they might feel that it's better for them, or they are more relaxed if they are getting the care from other sex, from as a male from a female nurse. So the level of anxiety with the degree of sensory perception and also the cognitive and coping abilities and manifested behaviors. We will come to the level of anxiety. Also, I think you took it in psychosocial. Did you took anxiety with psychosocial? Still? So, anyway, there might be some difference because those issues, there are some difference always. The level of anxiety, can be categorized to mild, moderate, severe, and panic anxiety. The sensory perception for each one of them. In mild anxiety, you might find that at this state of alertness, it will be affected. Increased activity sometimes of hearing, vision, smell, and touch. So he is trying to use all of his senses and concentrate on his senses. The cognitive coping ability, we have to enhance the learning of those client. Problem solving, because he is feeling, when you are mild anxiety, by the way, is it a good thing or bad thing? Mild anxiety, or to have a certain no, why? Normal, yes. Why? Because it will enhance you to do some things. If you are not anxious, if you are not having anxiety regarding your exam, you will not study for it. So you might fail, isn't it? But that anxiety, it is empowering you. It will give you the power in order to overcome the problem. So, my anxiety, it will create more attention. So in that case, the client might have many questions and he will ask those questions, so you have to answer them in this case. So the behavior that you might see in him, that he is walking, sometimes singing in order to avoid that anxiety. In some, they are eating more and drinking more if they are having mild anxiety. Restlessness, they are active listener, attending and questioning. So this is a positive sign, the attending and the questioning. So you have to answer his question in this case. The moderate, in this case, there will be decrease in sensory perception with guidance able to expand sensory failure. So when it is coming to moderate anxiety, so loss of concentration will come. So if the anxiety level become more, in this case, if you are reading or studying for your exam, you will feel that you are not understanding what you are reading, isn't it? So you start reading, but you couldn't understand what you are studying. Why? Because the level of anxiety is becoming more. So loss of concentration will be there. Decrease cognitive ability. Cannot identify factor contributing to anxiety producing or the producing situation of that anxiety. You cannot find why the anxiety is coming. With direction and coping. So in this case, we are in need for someone to direct us, to help us to cope with this anxiety and to reduce this anxiety, and to find or to help in giving a solution and finding the solution that might inhibit the function. So the behavior here, there will be increase in muscle tone, pulse rate and respiratory rate. It will be up, change in voice and tone pitch of sound, rapid speech, incomplete verbal responses. So, crossed with details. So those are the signs that will appear on our claim. In severe anxiety, greatly diminished perception. So you cannot see properly what's going around us. We cannot conceptualize what is going around us. Because of that, sometimes if we are anxious, we might pass by our friend and we will not recognize that they are there. They might greet us, they might talk with us, but we couldn't respond because we did not recognize that. So, a greatly diminished perception, decreased sensitivity to pain also. So, the cognitive and coping ability here limited through processes, unable to solve. We will not be able to solve our problem even with guidance. Cannot cope with the stress without help. Confused mental status and limitation of function. You will not be able to do our function. Purposeless, the behavior, it will be purposeless. So there will be change in behavior. Aimless behavior. The pulse will be very high. Respiration also will be very high. Our blood pressure, it will increase because of our internal chemical environment. Hypertension, hyperventilation, inappropriate or incongruent verbal responses. Sometimes the verbal responses is away from the question or what we are talking about with the client, and it is incongruent. In panic, no response to sensory perception. This is the very severe case of anxiety. So, no cognitive and coping ability is there without interventions. And death is imminent if we are not intervening. It might lead to death. Because, immobilization will be there. He will not be able to do anything. Immobility will be there. Because all the system, it will start to diminish their ability to work, to do its function. Due to high blood pressure, he might have a stroke due to very high blood pressure. So those are the things related to that. We have also nursing strategy to reduce the client anxiety. In order to reduce anxiety, you have to be an active listener and to show acceptance of others. We have to be honest with them. So honesty and answering all of those questions of our client at the level of their understanding. Don't use jargon, don't use medical term while you are explaining to him. Use the language that can be understandable for them. Yes, sometime we might find some of the people that start to use some medical terms. We have to avoid them while we are dealing with our client. Clearly explaining procedure, like surgery, like X-ray, like all of the procedure that we have to do for our client. We have to clearly explaining it to them. Yani, once one of our friends, he went for MRI. You know MRI? Magnetic image. And when they put him in that table, you know that he will enter in that machine, and the machine will produce sound. That sound, it is high sound. So when they start the procedure, he sat up and he thought that the machine's got something wrong with it. Why that happened? Because they did not explain to him that this machine will produce sound, and it is from the normal thing of the process of doing that images. So in this case, they have to start again and to put him in the position again, and it will take time, isn't it? So always when you are doing any procedure, you have to tell your client what you are going to do. What's the expectation? In order to have his cooperation. Otherwise, he might not be cooperative because he don't know what you are doing. Acting also in a calm and hurried manners. Speaking clearly and firmly, but not loudly. Give information regarding laboratory tests, medication, treatment, and rationale for restriction of activity, if activity is restricted. And rationale for giving all medication, while we are giving that medications. Setting reasonable limit and providing structure. Encouraging a client to explore reason for his anxiety in order to find solution for that. Encouraging self-affirmation through a positive statement such as I will and I can. Using play therapy sometime with doll, with puppets and games. This is working more with young children or adolescents. And even though they are, might be coming with or beneficial with others. In some hospitals, they are also using some other relaxation technique, like play, like playing games with the client, like also playing music and training them how to do, or drawing. So all of those aspects might be helpful. Using therapeutic touch. Touch, we have to put many lines under it. You have to understand the meaning of touch in each society. And to use it properly in order not to be misunderstood. Giving warm back rub for your client, this will lead to more relaxation. Inhibiting recreational activities such as physical exercises, music, card game, and board games, and craft. initiating, not inhibiting, initiating and starting those activities. Teaching breathing and relaxation exercise, deep breathing exercise and relaxation exercise. Use guidance imagination or imaginary. You will ask the client to close his eye, imagine that he is in a forest, imagine that he is in. So by that, it is a kind of play. Practicing covert rehearsal of what he wants to do. It might be 2 slides or so I will continue with that. Instead of giving a break and coming back. So, sorry, it is the last, it is the last one, and after that there is just only 5 minutes. So tips to reduce relationship barriers, we have to establish, as we said, trust. That's just repetition of that. Demonstrate caring and empathy. Empower our client. Recognize and reduce the client anxiety. Maintaining the opportunity of personal distance and practice cultural sensitivity and working to bilingual if there is different in the language that we are speaking. Using therapeutic relationship building activity such as active listening. Also, we have concentrating on active listening. We have to avoid medical jargons. There is also another thing, is a very small thing related to nowadays many of us, most of the people, they are using social media. In social media, if we are using the social media, also we have to follow all ethical issues. It might not be there or listed in the previous ethical issues. This is the use of social media. Sometimes some of the people, they are misuse those social media by taking sometimes photos for the client and then upload it on any of those programs like the YouTube or TikTok or those social media thing more than me and you are more familiar with them. So we have to avoid those things. And even though in most of institutions it is not accepted for a health professionals to be there or to be engaged in advertisement. Previously it was the advertisement. So we can't say, we cannot as a nurse come with our address and say, we are as a nurse, we are advising you to use so and so. So this brand. It is not accepted for the professions. So we have to understand the limitation, we have to understand the legal aspect of that, because we might be asked and we might put ourselves in trouble while using those things. Even though, let's close this.